Welcome to Pharma Fluency. I'm Janine from Pharma Fluency, and in today's episode, we'll look at mastering HCP engagement. This should be helpful for pharma marketers and the field force. I'm excited to share this episode on HCP engagement. HCPs don't have the time to sift through exhaustive data for every new product. Their primary focus is patient care, and in doing so, they lean on familiarity and proven results. This conservative approach means that a new product must overcome a steep barrier of trust. Early adopters are extremely rare amongst the doctors. To get an HCP to change his prescribing habits or to try a new product is difficult. This is where the bond between pharma representatives and the HCPs is vitally important. The HCP has to know, like, and trust you before you can ask for the business or expect him to change his prescribing habits. And this bond, the bond between the rep and the HCP, isn't formed through one meeting. It comes from many careful and effective interactions. Let's have a look at the know, like, and trust framework. To begin with, HCPs need to know who you are and to understand your product. This is achieved through consistent, clear, and simple communication. We have to call on our HCPs often, and every interaction should be simple. It must share clear information about key product features like efficacy, tolerability, and patient access. Access to clinical trials and detailed data is essential, but still, the first conversations should stay focused and easy to understand. Allow the HCP for more information when he's ready, rather than overwhelming from the start. So the HCP has to know you, has to be familiar with you as a representative. Secondly, he has to like you. And building likability goes beyond the facts. I prefer representatives who are knowledgeable, personable, and relatable. There has to be warmth. So we must avoid turning every conversation into a lecture on our academic prowess. Instead, focus on the HCP's needs and listen with intent. And let him drive the discussion. The HCP must feel heard and valued. And thirdly, trust. Trust is the ultimate currency in pharma marketing. Once an HCP knows and likes you, they are more likely to trust your recommendations. And trust grows when we share accurate information and show we understand the HCP's challenges. When a representative shares content that is both accurate and engaging, the know, like, and trust graph rises. And only at this stage can we, as representatives, confidently ask for the HCP's business or ask him to try our product. Now, how do we get the doctor to know and trust us? What are the essential ingredients? Well, at every call, at every interaction, we need to educate, entertain, and inspire. Let's have a look at educate. This is the power of simple, clear messaging. HCPs prefer simple explanations. While they are capable of understanding complex data, they usually don't have the time for a deep dive during every interaction. Promotional material and detail aids should focus on the crucial aspects of the product, which are efficacy, tolerability, and patient access. Efficacy, how well the product performs with evidence. Tolerability, its safety profile and ease of use. And patient access refers to the pathways that ensure patients can receive the product without undue hurdles. Keep the HCP's needs at the center of the conversation. Don't focus too much on your academic credentials. And also avoid getting lost in the details that could overwhelm others. Give clear, concise, and relevant information. This helps HCPs make informed decisions. The next ones are entertainment and inspiration. Medicine is a serious field, but that doesn't mean every interaction needs to be somber. Some of the best marketing campaigns have used humor and entertainment. Campaigns like the 7 Dwarfs of Menopause, or the latest Calpol advertisement and early Viagra advertisements proved that fun and creative methods can catch attention while staying professional. Humor isn't right for every product or situation. However, being entertaining can make your message more memorable and relatable. And inspiring. Inspiration is a powerful tool. Real stories, like a strong patient testimonial or a tale showing your product's real efficacy, these are very convincing. Inspirational storytelling not only reinforces the value of the product, but also connects on an emotional level. When an HCP hears a good story about a product's impact on a patient, it turns abstract data into a clear promise of better outcomes. So finally, the marketing team and the field force must work closely together. This way, they can create a great mix of education, entertainment, and inspiration. Marketing gives the tools and content, and the field force adds personality, empathy, and responsibility to each call. This teamwork makes HCPs get clear and engaging messages. It meets their needs and helps build strong relationship. So when each of the field force's touch points educate, entertain, and inspire, this builds the strong know, like, and trust bond. And this is the bond that leads to the ability to inspire HCPs to change their prescribing habits or to use a new product. I hope this has been helpful. Thanks for listening.